Okay, so how things live in our body is way different than the images or the diagnoses or the little studies that get done. How things live in our body is very vibrant and very involved and very integrated. Okay, and so we want to understand some functional information about nerves. Then we're going to talk about the science of nerve function, injury, and suffering. Okay, because that's important, right? And then don't worry, because I am going to reveal the truth about the vibrant healing capacities of nerves and how to harness them. So how do you help the nerve to really start to heal? And so first, let's get into this functional information about nerves. And to do that, I am going to share my screen. So give me just a moment here. Now, while I'm sharing the screen, if you want to, again, momentum matters, right? If you are interested in coaching, go ahead and comment coaching. If you're here because you're dealing with pain, you're dealing with an issue, go ahead and comment pain. If you're here because, hey, I'm not really having pain anymore, but I'm just not able to do things the way that I used to do, and I'm not sure how to get there, then comment performance. Okay, that's really what we mean by performance. So here we talk about going from pain to performance. And the performance side is just basically how you want to live your life, how you need to live your life in order to feel good and happy and all those wonderful things. Okay, so here we go. All right, as always, I just grab images that you'll find on your computer. I am not so these images. I pick these images because they serve our purpose, and I leave the location there because I'm not trying to snag people's stuff or steal people's stuff. I have not vetted these resources though, so I haven't gone through. If there's a business or something like that, you need to go through and vet it. Okay, so we're talking about the living nerve. Okay, and so when we're talking about the living nerve, let's make sure we know what we're talking about here today. Okay, so the pinkish, peachish, and red stuff, these are elements of the central nervous system. So your brain and your spinal cord. All right. Central nervous system is kind of a different animal than the blue stuff, your peripheral nervous system. Okay, and this isn't complete, but this gives you a good idea of the main nerves in the body. And if you're wondering about nerves and kind of what is a nerve, there is a training that I did before on nerve structure. Okay, so if you're curious about what a nerve is, and you want to know some of the details about that, comment nerve structure, and I'll get you to that. Okay, just in a nutshell for this training, what I want you to realize is that a nerve is not a single cell, it is a structure. And in that structure, there's a bunch of nerve cells that are like really long, thin things, and they're packaged. They're packaged with this connective tissue matrix that brings them all together and sort of like a cable of sorts. But this cable you can squish it, you can roll it, you can bend it, you can stretch it, you can do all kinds of things. It's really an incredibly durable and vibrant structure. And as long as some of that structure remains intact, you got a good chance of recovery. When you do suffer some type of nerve damage. And let's, if you're worried about nerve damage, if you're worried about permanent nerve damage and whether that's a risk for you, there's another training. Okay, so if you're interested in that training, if you're wondering, gosh, am I headed towards permanent nerve damage, just comment nerve damage and I'll get you that one. Okay, just so we understand what we're talking about peripheral nervous system and especially how that affects pain and movement. And so let's go ahead and get started. Now, one of the things that we want to understand is that these nerves, while they can handle some compression, if they get too much compression or compression in just the wrong spot, they can start to suffer. And I talk about that a lot more in the nerve structure. The other thing, so compression is a way that the nerves can suffer. The other thing that can happen is a nerve can get stretched. It can get overstretched, right? So they do have some stretch to them, but it can get overstretched and that can produce injury. The other thing that can happen is, so nerves, as they go through your body, they have to kind of slide as you move. So they kind of slide one way and the other, depending on the forces, right? The physics acting on the structure, and then that acts on the physiology of the nerve. And so if there's like a hitch in the giddy up where it can't slide well anymore, then that's another problem we can run into. So the three things we're really talking about are compression, we're talking about a tension problem, or we're talking about a sliding dysfunction. Those are the main ones that we're going to talk about today, because they're the ones we can work with recovery. There are other things that happen. If you don't know if that's you, or if you don't know if what we're talking about applies to you, just comment support. Okay, comment support and I'll reach out. That's kind of a key word here. Anytime you need more information, just comment support. Especially if you tag me. Hey, if we're not friends, make sure we're friends on Facebook. So go friend me, and make sure that we're friends on Facebook. That way you're going to see this stuff easier, and we're going to be able to communicate easier. Okay, so we talked about compression. So one place that a nerve can get compressed, okay, one place that a nerve can get compressed is at the nerve root. Okay, and so basically what's happening here, this big gray thing here is part of your vertebra, and these little wings that come off to the side, transverse processes, and then these wings that come off the back, spinous processes, they're all part of the bone. Okay, and here's one, and then down below is another. Now, through the channel runs the spinal cord, and then the spinal cord, as we saw in this previous image, the spinal cord runs up and down, and then these branches of nerves branch off to the side. Okay, so what we're seeing, like right here, you can kind of see how a branch is coming out. They kind of aren't really showing the branch coming out here, but just pretend like there's one coming out here. Now, between the vertebral bodies, okay, these are kind of the load-bearing element. These vertebral bodies over here, they're the load-bearing element of the spine. Between them are discs, and this disc is suffering. Okay, they're showing you. They're even making it red. Okay, so alarm. Okay, and the way this is suffering is it's being compressed in a way that's pushing the material out the back. Okay, it's pushing the material out the back. And so literally the nerve root, as it exits the spine, is being compressed at the spine. And so this will create like a true radiculopathy. This will create like a true cervical radiculopathy or a true sciatica. There are things that mimic, they have similar symptoms to what would be a true cervical radiculopathy or a true lumbar like sciatica problem. But this would be a true one. Okay, so this is one place you can get compression. Okay, and so in another training that we have, we talk about the structure of these discs, and we talk about how these forces act on these discs and how these forces can break these discs down. And with that, then we also start to understand how we can change the forces on the disc and help the disc to recover. Okay, and so one of the things here that we'd look for is to help this disc recover. But in my view, we always want to start with a nerve because it's a nerve that's having the problem. So I actually don't specifically start with disc recovery. I tend to start with nerve recovery and just help you feel better faster, and then we can work with the disc over time. Okay, so another place that the nerve, and sorry guys, hey, I'm showing from the neck. Okay, yeah, I should have announced that. I'm just showing from the neck to help you understand these principles and the fact that this compression can happen in different areas. And the areas that I'm showing are not the only areas. So actually muscles can get involved and create compression, and there's other bony things that can form that can cause compression. But these are kind of the main areas of compression in the upper body. Similar processes happen in the lower body. So if you're suffering like a sciatic, if you're suffering symptoms down your leg or off to one side in your low back, some of these same principles apply to you. But I'm just using these images for efficiency's sake today. Okay, so the thoracic outlet is kind of this tunnel that goes underneath. So these yellow things are the nerves. Okay, so they have exited the spinal cord at so this is the neck here, and these are the cervical vertebrae. Okay, the bones of the spine. And the nerves have exited, and as they exit, they kind of come together in this little package, and they go underneath the collarbone and above right here, the first rib, and then the second rib usually isn't a problem. But sometimes this first rib can give a problem. Sometimes either one of two things happens. Either the nerve because there's an issue here. Now the nerve is inflamed, and so now the nerve is bigger and it's not fitting through this space as well. So if we actually went after this space and tried to recover it, we wouldn't see much recovery. But if we do something to help the nerve here and something to help the nerve here, then we can start to see some recovery. So the yellow things are the nerves going under the clavicle. This is the collarbone, okay? And as they go under the collarbone, and this over here is the shoulder, and then they descend down into the arm. So this is a space that can get compressed, all right? And I'm already hinting at recovery. I'm sure you're catching that, okay? So as we go down the arm, another really common spot for the nerve to get compressed. So again, the nerves are the yellow things that come down. You can see how they go all the way down and start to innervate down into the hand and the fingers. So this is a long thing, right? It's coming from here and goes all the way up to your spinal cord. All right. So that's that cell is a super long thing, and the nerve is a super long thing. And the nerve, as it gets further and further, kind of these little cells kind of branch off, and that's how they innervate these different tissues. So what we see here, so they even kind of give us some red here. Okay, this is cubital tunnel syndrome. So kind of the inside part of your elbow. There's a spot where the nerve drops down, and there's a tunnel it goes through, and that tunnel, you can have an issue with that tunnel. Either there's inflammation of the tendons, or maybe there's some bony formation happening, or maybe the nerve is swollen. And so now when you flex your elbow, the tunnel, like when you bend your elbow, the tunnel does get smaller anyway. And when you straighten your elbow, the tunnel gets more open. So sometimes even just the swelling of the nerve can cause this to become a problem. So again, we want to make sure we're addressing where the irritation is coming from. All right. So one more spot we'll look at, really common in the arm, is at the carpal tunnel. And so the carpal tunnel, you see there's this connective tissue that goes over, and then the nerves come up through it. Okay. So this is the hand over here on the left, and the yellow are the nerves again. And so the nerves kind of come through this tunnel. So what we can look at is over on the right. Now we're looking at just this little segment that's kind of cut away. And in this segment, we can see, oh, look, they made the nerve red for us. Thank you. So we know that nerve is being compressed. That nerve is being irritated. So all we have to say is irritated. The nerve is being irritated, and that's going to create a problem. And when a nerve gets irritated, it tends to become irritable. And so that's why you have symptoms. Okay. That's where the symptoms show up. So what's happening can look a lot different than what you feel. Okay, so this could feel like a stabbing in the palm. You could have numbness in the fingers. You could have tension in the fingers. There's all kinds of things that could be going on in your hand. You could have a lot of pain in the wrist here. But this is all from compression. Okay, now if you remember, we talked about that tension can be a problem too. So the nerves do stretch, but if they get overstretched, we can have a tension problem. And so I actually had an accident one time. I was riding my bike home from work, and I was trucking. It was ice cold out, and there were little flecks of snow, so I couldn't see great. I was going down the side of this main road in the town I lived in, and as I'm pumping along, trying to get speed down this hill, all of a sudden I see this rock, and it was a big rock. It's normally a really clear shoulder, but here there was this great big rock, and I raise up a little bit, like just naturally to kind of get a better look. And yeah, it's there, but now I'm on it, and I hit the rock, and so my bike goes flying up forward. Okay, and as I go flying up forward, fortunately I'd been in a martial art where we practiced lots of rolls, and so my body naturally started shifting into this rolling position, but I had my feet in toe clips. And so as I came up, it actually, the momentum swung me forward, and I planted into the concrete with just like this image. So my helmet, fortunately I had a helmet on, my helmet was being smacked up here, and my shoulder was being smacked here. And what ended up happening was the collarbone was partially dislocated. So I partially dislocated the collarbone, but what I didn't realize and what you could easily see here is that these nerves also got stretched. And so my shoulder, the function in my shoulder and everything was off for a long time. This was way back before I really knew what was going on. But you can see how a strong stretch here could cause some damage and cause some irritation. And that irritation could sort of self-propagate. And actually that irritation could cause another irritation. So we could end up with a thoracic outlet because these nerves get swollen and now they start to get compressed in the thoracic outlet. Or the nerve may propagate that inflammation all the way down, even as far as into the hand. And so now we start to get some swelling and inflammation down here because the nerve propagates inflammation, and we can get a sort of a pseudo carpal tunnel going on from this or from that cervical radiculopathy that we mentioned before. So tension, too much tension on a nerve can cause a lot of problems. Hey, I've been gabbing for a long time. If any of this, if you relate to any of this, just comment relate, okay? If you relate to like the compression at the neck, hey, I have images. I know that there's stuff going on at the neck, or I have images and I have electromyographs showing that there's dysfunction. They think it's from the thoracic outlet. Just go ahead and comment relate, okay? And let's keep that momentum going for you. Okay, so one of the things that we can actually do is we can actually purposefully stretch nerves, and there's a specific way to target different nerves. These are kind of 4 foundational ways to target. There's 3 main nerves in the arm, but there's 4 main ways to target them. And don't go doing these things to where, like, if you want to like grab this picture and check these out, you can do it, but beware, right? User beware. Stretching a nerve, if a nerve is stretched for too long, which can be as short as 10 seconds, it can make it somewhat hypoxic, meaning it's not getting the blood flow. Now, when you release the tension, the blood flow will typically come right back. But if you already have some irritation or something like that, then you want to be cautious about these tests. And there's ways to modify these tests to understand if it's coming more from the wrist, if it's coming more from the elbow, more from the thoracic outlet, or more from the neck. So there's ways to fine tune these things. Okay, so when we talk about recovery, this is one way that we can use physics and physiology to understand where your problem may be coming from, where your symptoms may be coming from. And hey, lower body folks, don't worry. Here's a lower body version. So in this is called a slump test, and you know, this guy's slumping a little bit. I would actually have my people slump a lot more, but sitting, so the knee is supported by the table, the person sitting in this position, and the upper body, typically we're gonna have the upper body slump more, but hey, he's got his chin tucked. And so what happens when he slumps and his chin tucks is that the cord is actually pulled up a little bit. The cord is actually pulled up a little bit, and that cord attaches to the sciatic nerve, which goes down through the leg. And so with this hip flexed, now we're asking that nerve to be longer. And then with the knee extended, we're asking that nerve to be even longer. And then with the ankle dorsiflexed, we're asking that nerve to be even longer. So basically this position asks that nerve to be as long as possible. And this, for people with sciatic issues, no matter where they're coming from, this will probably light you up like a Christmas tree. So again, user beware. I'm just using this for demonstration, not suggesting that you try it. Okay, now look what happens up here. See how he straightens up and he extends his neck. So essentially what happens when he does that is that the tension that was created to pull the cord upward towards the head, that tension is released. So I don't know what's going on with this arrow, but that tension is released. So in a sense, the cord can now shift downward. Okay, and as it shifts downward, he extends his knee and dorsiflexes his ankle. And so now he pulls the sciatic nerve this way. Okay, and so this is where we're getting into a slider. Okay, and so a slider, what he would do then is he would release the tension on this end. So that would be bend the knee, relax the ankle, and then he could create tension in the upper body by slumping and flexing forward to pull the cord up. So we're releasing it down low and pulling it up. And so that slides the nerve this way. And so we can slide the nerve towards the foot and we can slide the nerve away from the foot. Nerves like sliding, okay? They don't necessarily like it when they're really irritated. So there's a step before that I like to use. But nerves like sliding, okay? And so this is a way to start to help a nerve to recover. Let's see. I think that's all I got. Yeah, okay, so what I want to do, that's not all I got, but that's all the images. So what I want to do is, remember we said we were going to talk about the truth about the vibrant healing capacities of the nerves and how to harness them. I've been kind of mentioning that all along. But what I like to do with my clients, there's two principles when we're talking about breaking loose from pain and moving towards performance, okay? I'm going to walk you through a mental model of a full and complete recovery. It's super simple, but I'm going to walk you through a mental model of a full and complete recovery. So when that pain is on us, when we're feeling it, and it's burdening us and it's affecting our lifestyle and it's kind of front of mind, that's what we tend to call the acute phase, okay? It becomes our world, so to speak. And if you guys have not heard this before, we talk about the price of pain. So pain isn't just that it hurts. Pain is all the aspects of your life that it affects, and how deeply it affects those aspects of your life. When I actually interview people, when I do coaching, we get in depth on that, because once I know how this pain is interfering in your life, it makes it really clear where we need to start and what steps may need to happen. And then we get really clear about where you want to end up. Okay, but let's back up. So we're in this acute phase. The pain is pressing, the pain is forefront in our mind, okay? Once the pain starts to go away and we're able to do more things, but maybe we're timid, okay, because we're fragile and we know it, okay? And if we don't know it, we find out because we try things and, oh man, here we go right back into that acute phase, and we come back out of it and we're back into it and out of it. This is actually where I end up finding a lot of people. If you can relate to this, okay, this is called the critical phase. This is called the critical phase, where you're fragile. You're not suffering that pain. So hey, if you're suffering that pain, comment acute, ACUTE, okay? If you're past that, but you're really fragile, comment critical, okay? Now, where we want to get to is to functional, okay? But most people, I will say most people who get hurt never, ever get out of the critical phase. They may think they do, but really what's happened is they've compromised their lifestyle. They've compromised their lifestyle, and they never really get to that place where they can do the things they want to do again, to where they're functional, okay? So if you're in that critical phase, comment critical, okay? And then functional. Now, some people want to take their bodies and really harness the potentials and to do, big things. Marathons can be in this. 5K might be, depending on the shape of your body and your joints. A 5K run might be. But it could be, so I had a client who did 10 days at Disney World with her grandkids. That was a stretch, right? Like for her to planes, trains, and automobiles and rides and standing and walking and having been in the past, when I met her, she was at the ER almost every single month because her spine was so damaged and she had so much pain. So then the next year, I get messages, I get to see images of her at Disney World, right? That's pain to performance, going from the pain being forefront, or the pain being kind of in the back of your mind, to where you're scared to do the things you want to do in that critical phase, to being functional, able to live life, able to make plans and live life. So that's a target. So the way we do that, the way to get started, we call two things, okay? One is the unload. Okay, if you're in this acute phase, we need to unload first. So quite often therapists want to start ahead of this. And I feel they either tell you just lay down and rest, and then you're like, well, what do I do? How do I position my body? I don't know what you're talking about. You're kind of left to figure that out on your own. So what I do is I help people with specific information, and we actually do it very scientifically. And what we're looking for is a way to reduce the irritation on the nerve and increase blood flow to the nerve. So if we can reduce the irritation and increase blood flow, the nerve is going to take care of the healing. We don't do anything to the healing. the nerve is going to take care of it. Now, there are foundations of things that you can do to support that healing. And I also educate all my clients about that. But first and foremost, we want to reduce the irritation to the nerve. So this is the principle. I can't speak to your specific issue right now because you guys all have different ones. But the principle is to reduce irritation of the nerve and then help increase blood flow. Okay. So hopefully that's helpful in terms of a mental model of what you need to do. And then the next thing we need to do is to rebuild. So we have an unload and a rebuild. And the rebuild is about restoring healthy stimulation to improve movement and resiliency. Okay.